Have you ever found yourself in the middle of the night waking up, having the flashes, thinking about it, could not go to sleep? Next day you're waking up, it's becoming unproductive way. You are unproductive entire day, either because of anxiety, depressions, mental illnesses, you name it. And today, the reason I'm saying this, we have a really great doctor, Dr. Noel. He's a psychiatrist. He's also a forensic psychiatrist, being in our Central Florida for 20 years, practicing, treating people with schizophrenia, depression, and anxiety, and so on and on. And I like to personally welcome him to the show because I know how difficult it is bringing the psychiatrists in the studio and sharing their own ideas. Dr. Noel, welcome to the show. And we have a lot of questions for you.
Okay, thank you for having me.
Because we cannot control the mind, but mind can control us. And sometimes we need your guys' help to clear our thoughts. However, you are also forensic psychiatrist.
That's
Does
right.
that mean when we have a bad thoughts, you're getting deeper into it, finding the situation why we're having thoughts the way we're having it?
That is part of it. There are many aspects of forensic psychiatry. There is the criminal part of it, which is the one that you're kind of probably thinking about. But there are also aspects that have to do with the ability of people making decisions, if they're competent to make decisions, if issues of disability, issues of criminal, and within the criminal, for example, one thing that is very popular when people talk about is when somebody does a really horrible crime, and there is a question about mental illness, they think, oh, this is another person that probably will get off with the excuse of being mentally ill, for example. And it's a not so common defense, but it is a way that sometimes people get defended in terms of using like not guilty by reason of insanity defense. That's part of the forensic work. I don't do much of that, but it is included within forensic psychiatry.
Okay, perfect. So my question, you've been practicing for 20 plus years.
Yes.
At what point at the early stage of your life you decide, why should I be a psychiatrist? What drives you in? What is the point that drives you in to become a psychiatrist?
Well, you asked me a very good question, and one that I've been very happy to answer. As a medical student, actually, I wanted to deliver babies. That's what I wanted to do. I am the number 6 of 6 children, and I'm the last one, and all my siblings had a lot of babies. So I grew up around pregnant ladies and a lot of babies. So I decided I'm going to deliver babies. But when I went to medical school and did the psychiatry rotation, I found that it was easy for me to engage in a conversation with a total stranger and get that stranger to talk to me about the most intimate things. And I remember always that there was one of my instructors that said, forget about OBGYN, and you need to do psychiatry. You're a natural. That stuck with me. And eventually, although I did apply for residency programs in OBGYN, I decided to change to psychiatry.
Perfect, doctor. So now, everybody wants to be a medical doctor. Everybody wants to be an ophthalmologist. Everybody wants to be a dentist. But being a psychiatrist is totally another side of the field. As day-to-day activity and your life is going through, and you're seeing a lot of different patients, because when you have a go to dentist, at least person is normal. He doesn't have some kind of psychological, physiological.
Except for the fear of the dentist.
Yes, that's the only thing. But now you are dealing with Alzheimer's, you're dealing with dementia, mental illnesses, could be harsh, could be somebody who cannot pretty much do on their own, they need another help. What is the hardest part being on the psychiatrist?
I will qualify that. Depends of the kind of work that we do. For example, in the outpatient world, I don't think it's that difficult. Of course, it depends on the type of illnesses that you're dealing with. For example, if we deal with patients that have schizophrenia or have severe bipolar disorder, those patients can be quite a handful sometimes. Not that we don't treat them, but it can be difficult because there sometimes are non-compliant with the treatment, and they can become psychotic or agitated, et cetera, et cetera. But for the most part, the outpatient practice is not that, I will not say that difficult. I will say that the inpatient psychiatric treatment is actually more difficult because people are at their worst. They are being admitted to the hospital because they've been hearing voices, because they're paranoid, because they're agitated, because they're suicidal. So I will say that the inpatient psychiatric work is the most difficult.
Okay. And now tell us as a psychiatrist, now I know you are dealing in the whole new environment. You're working with work injury employees.
Yes.
When they get an injured and they lose a job, they need to get an attorney need to do whatever they want to do, then it comes you to evaluate it. What type of evaluation do you do? First of all, depression comes because we lose the job. Depression comes because now bills are piling up, but no money to sustain and paid. Inside, we psychologically become ineffective, and before even all of the friends we have, and now they are not our friends anymore. So as a psychiatrist, in the old field where you're coming from, and from the conventional point of view, now you're getting into the private sector, helping the people how to evaluate and bringing the case and giving them a hope to better life. How do you treat depression in that particular point?
Very good question. It's different. The approach to it has a lot of medical, legal aspects to it. Okay. In the workers' compensation world, we do with every other patient, we do take a very detailed history about past psychiatric history, about habits, about medical problems, etc. But also we take a social history. We also take a history of previous workers' compensation incidents. We take a legal history. We take so we gather all that. Then we also take the history that is related to the incident or to the accident and that brought that patient to a workers' comp case in first place. And then we make an assessment and come up with a diagnosis, which sometimes it is depression, sometimes it's PTSD, sometimes it's traumatic brain injury, sometimes it's an adjustment disorder. There is a variety of diagnoses that can come up with from a psychiatric evaluation of a workers' compensation patient. But as you said, when somebody is injured and then on top of that they start having problems with finances, with disability, I cannot move my arm, I don't sleep because my back is killing me, and the whole situation starts to deteriorate. That's when the patients become depressed, for example. And so the approach is a little bit different because we do treat the depression like with the same antidepressants that we treat otherwise, but we also have to keep in mind, and I keep in mind, the other aspects of the medical care in terms of are they getting the proper evaluations by the orthopedic surgeon, are they getting the treatment by the pain management doctor, are they being looked after? And that is a more complete, I will say, a bigger. We have to take a bigger picture of the workers' comp patient.
Mm-hmm. Is there any special consultations or counseling when it comes to that point when somebody is really depressed, and prior to being an injury, they also carry a huge negative effects before they even get involved? How they are different from the person who come with a really well financial? The reason of my question, people who is well set financially and somebody who is not, do you see a big difference, big diminished problems, or big point or big difference between somebody financially knowing they're not gonna lose everything and they come up to you, and the way you evaluate the behavior is completely different from somebody who is not in that substantial financial situation?
Absolutely, it makes a huge difference. In the workers' comp cases and otherwise as well,
Mm-hmm.
Access to care. Because of lack of financial means, it will be always a problem. Obviously, the people that have the resources will have better access to care, no question about that. But the government has provided certain types of public care that is available. And in terms of within the workers' compensation world, of course, if the person happens to be fortunate enough to have reserves in terms of financials, then it would not be suffering as much as the one that is not being paid by the insurance company for a couple of months and are about to lose their car or lose their house or their apartment because they don't have money to pay. And which piles up into the depression and anxiety and anger.
And I want to ask you this question. I believe is a really important question. I know a lot of people love to hear. You as a psychiatrist, you distinguish yourself from the rest of the people who don't have a psychiatry degree. When you get mad and sad and negative, how do you fix your thoughts? What do you do differently?
I am blessed with, I guess, the genes of my mother.
Okay.
My mother was a very happy-go-lucky person and very funny, and really very rarely I remember her being angry. Are we exempt for being angry? Are we exempt for being sad? Or are we better than everybody else? No, of course not. But I don't let things to stay with me for too long. I try
so how do you shift the thoughts?
How I shift? I'm sorry.
How do you shift the thoughts? How do you go from negative to positive? Yeah.
I try to always. It's again. I think it's nature that I see the glass half full for the most part. I was commenting to a friend just recently that it really takes a lot for me to get angry. I just don't. I get frustrated with injustice. That I do.
Okay.
And one of the reasons why I enjoy what I do is that I not only treat the patients, but in some way I help them with getting the treatment that is other than psychiatry that they need and deserve.
So even I can say, even psychiatrists get frustrated, so no wonder why we do.
Absolutely,
Okay,
we do get frustrated.
So now we know everybody feels better.
It's absolutely
My other question is like, did you ever have a patient who tried to diffuse or tried to not to use a medication, tried to refuse total medication, and what particular approach would you do in that particular situation?
Sure. It depends on the case, of course. There are cases, for example, I just did an evaluation recently that I thought that the symptoms were not so severe. And this young man really was not inclined to take any medications. And I was not either convinced that he needed them. So we quickly agreed that the best thing for him was to do counseling about the situation. And we just left it like that. Now, there are some cases that, talking about frustration, that I really believe that the patient would benefit from taking medications, and sometimes they don't want to. I just, educate them, tell them, I think that you will be better off if you do this, but at the end of the day, it is your decision.
As a psychiatrist, everybody wants to know, what is a delusional mind?
Well, a delusional mind is... let's actually define what is a delusion. Delusion is holding a false belief, and you really think that that's the truth. Example, let's say we're in this room here, and there's a little machine there with little holes, and other than the camera that is filming this, I will say, no, there are spies that put a little camera in that little hole there. For example, that is a false belief because I'm sure there is not. Although I have to check, just kidding. But
pretty sure it's
but
not.
Yes, but it's just holding like it's true. I remember, and there are many types of delusions. I remember a poor man a long time ago when I was in training who was admitted, and he was extremely depressed, and he was saying, I'm depressed, I lost everything, I'm poor, I'm ashamed for my family, and he was saying all this, and we just felt like sad for him. And then the family came to talk to the staff and to his assigned resident, and the guy was a multimillionaire. Wow. He has not lost a dime. Wow. It was all in his mind. He was not poor at all. Actually.
But in his mind,
he was
on the other side.
And he was, actually, that's so-called delusion of poverty.
Okay.
But there are delusions of grandeur as well. and religious beliefs and
norms.
the religious delusions. I always remember one lady who really thought that she was the Virgin Mary, and people were just actually kind of chuckle about it, but it was very serious for her, and she was convinced that she was.
Okay. So in 20 years practicing, tell us what was one of the most rewarding thing that you have accomplished or experienced as being as a psychiatrist.
Many. I will. A couple of cases come to mind. One, I was with my son. My son was maybe 12 years old, and I'm walking in a hospital, and all of a sudden I hear a gentleman coming to me. I said, Dr. Figueroa, and it was a Saturday, and I said, uh-oh, who is this and what's he wants? Did I do something that this guy is upset with me or something? And has to be here with my son. But no, I really didn't recognize him. And he said, you probably don't remember me, but I saw you one time at a certain hospital, and you saved my life. And I said, I saved your life, and I saw you once? And I said, okay, remind me. And he did, and actually it came back to my memory. It was a gentleman who had tried multiple antidepressants, and the attending physician wanted a second opinion. And I did a second opinion, and I recommended a certain medication, and that medication really made a huge difference in his life. And he said, if I would have not got better, I would have killed myself.
Wow, will be total suicide.
Yeah.
So now my last question, doctor. Somebody depressed, anxiety, depression, you name it. All of these other negative thoughts rather than positive thoughts. A lot of times we have more negative thoughts in our head than actually positive thoughts. If you can look it up in the camera and say, how should we stay day-to-day basis positive? And what do you do as a psychiatrist on day-to-day activity on daily basis that you stay in a positive?
I think that we have to be grateful. We need to think about the things that we do have instead of thinking about the things that we don't have. You know, sometimes we complain that we don't have Wi-Fi. Okay, that's a third world problem, right? And so what? And again, a lot of times we said, oh, my car is broken. Well, that people don't have a car. They just take a bus every day, right? Or we don't have air conditioning. Well, there's a lot of places that don't have air conditioning. I think we have to count our blessings, and we are really blessed that live in a nation that we live a good life, really. So I think that being grateful for what we have and think about the positive things instead of dwelling on the negative, that's the key. And also be kind to other people and be open and be humble and be open to be wrong as well. We need to know that we don't know everything and that we can learn from each other.
Perfect. So guys, thank you again. That was a special guest, Dr. Noel. He's a forensic psychiatrist. His office is right here in Oviedo. If you ever need a help consultation, please reach out to his office. I went to his office, beautiful office. I love everything, the way they put decorating. Like when you're getting in, you're pretty relaxed. I mean, if you come depressed, probably by the time you leave his office, you will be impressed. Not depressed, impressed. So Dr. Noel, thank you so much for coming on our show. Thank you so much for sharing your insights, expertise, knowledge, and thoughts. And it's a blissful interviewing you and knowing you as a friend, sure, as well as a future guest in many podcast shows that we're gonna serious in the future. We wish you the luck in this year and next year and so many prosperous years to coming, because I think you are a blessing for Oviedo.
Well, thank you
and
very
for
much.
all the Central Florida citizens.
Thank you, and it's been a pleasure to be here, and I'm looking forward to more, and we'll do as many as you want me to do.
Yes, we will do that. So you heard what the doctor said. He's open to do many there.
Absolutely.
So your special host, Tiggy, our special doctor, Dr. Noel, he's psychiatrist, forensic psychiatrist, Please like, share, and care, and that's all what we can do. We can educate you. Thank you. Please follow us. Thanks.